Hi, I'm Kate and I'm a mum of 6. I have 2 older children and 2 sets of twins. Both sets of twins have all experienced RSV at varying levels of severity. But for me, it was the unknown, because it was going into hospital with babies with this very fast breathing rate, tugging here, and being seemingly unwell, but I didn't know anything about RSV. I just thought that they had a cold and they'd got more poorly.
Dr Simon Drysdale, I'm a consultant in Paediatric infectious diseases and immunology at St George's University Hospital NHS Foundation Trust in London in the UK. Clearly, during the COVID pandemic, there's been a lot more public awareness around interventions to reduce transmission of viruses. So going forward, we should try and continue to use some of these measures to try and prevent our most vulnerable and youngest infants from developing RSV infections.
So having had both sets of twins have RSV, one of the things that has been a big learning for me is about the impact that an adult having a cold can have on a baby, and then the risks attached to the transmission of RSV, and then the impact on perhaps that baby being unwell and needing hospitalisation. And so now I really encourage anybody, don't mix with people if you've got a cold and they have a baby, because you could be putting that baby at risk.
So when my children were small, we made sure that we washed our hands around them, we made sure that we used tissues and threw them away appropriately, and tried to ensure that people who were unwell didn't come too close to them or didn't sort of cough or sneeze or touch them without washing their hands.
With our babies, it was the fact that every time they coughed, they vomited, which meant that they weren't able to keep their fluids down, so they were becoming very dehydrated. And ultimately, a milk-only fed baby, so a baby under 6 months, is so reliant for their hydration and their nutrition and their general well-being. And if that is not happening, then they need medical intervention. And I just think parents need more information on that. I think we need to know more about it, and particularly as we come into the time of year where RSV is much more prevalent and this spike is emerging, is that parents are aware of it, know what to look out for, and know when to get medical help.